5 to 10% of the cases of psoriasis can be hereditary. If a mother or father or sibling has a psoriasis, there is an increased risk of getting psoriasis. Hello everyone, I'm myself Dr. Navyashree and I'm a dermatologist and I'm practicing at Karnataka in a place called Mandya. So today I'm going to discuss about few things about psoriasis, so which is one of the most common presentation we'll get in our OPD. So what is psoriasis? So psoriasis is nothing but it is a skin disorder. Nowadays it is not only called as skin disorder, it is considered to be one of the systemic disorder. It can involve the other organs also other than skin. So you should be very careful that you should take treatment for psoriasis. So most of the patients ask us like whether psoriasis is hereditary. Yes, because 5 to 10% of the cases of psoriasis can be hereditary. If a mother or father or sibling has a psoriasis, there is an increased risk of getting psoriasis through hereditary. What are the types of psoriasis? So how do you know it is psoriasis? So you can just see the symptoms and signs. Like most of the symptoms, most of the patients present to us with scaling. So you can get some scaly lesions over the body. It can involve any area of the body like scalp, forearms, or it can involve the nails also. So whenever you get any symptoms and signs of psoriasis, it's must to take treatment from a dermatologist. It can involve any area of the body. So the treatment differs from each different area. So you have to take the treatment of psoriasis as soon as it is diagnosed. So one more important question the patient will ask us is whether it will transmit from one person to another. No, that is not true. It is a myth that psoriasis will transmit from one person to another person because it is not a contagious disease. So what do you mean by contagious disease? It doesn't spread from one person to another person because it is there are multiple factors which can cause psoriasis. One of the important causes genetic factors. Second one is alcoholism and smoking. It increases the risk of psoriasis. The third point is the most common thing is drugs. Few important drugs which are prescribed for other conditions can increase the risk of psoriasis. So these are the few important points which can cause psoriasis in the patients. What are the different treatment modalities available for the psoriasis? So psoriasis can be treated based on the severity, whether it is involving the whole body or it is involving the particular site. For example, scalp and nail psoriasis have got different treatments. So if it is extensive, then there is a different treatment. So we have got so many modalities of treatment. So first one is medical line of treatment and second one is phototherapy. So medical line of treatment, usually it has got a few drugs we'll give like methotrexate and cyclosporine and etc. So then the second point is like you'll get phototherapy where you'll focus the light over the lesion so that there will be decreased proliferation of the cell. This psoriasis is mainly caused because of the increased proliferation of the cells. Usually the skin will shed every 21 to 28 days. But what happens in psoriasis is the skin will start shedding within 3 to 4 days. So the skin shedding time will be decreased in psoriasis. That is, the skin starts shedding within 3 to 4 days compared to 21 to 28 days of the normal skin. So there are so many other modalities of treatment, like phototherapy is the best way of treatment for treating psoriasis, and nowadays there are recent treatments available like biologics. Biologics are the drugs which should be given under the supervision of dermatologists. So I request you to visit a dermatologist whenever you get any skin complaint, that to a qualified dermatologist. Like MD, DNB and DDBL dermatologists are the qualified dermatologists from the association. So I request you to visit a qualified dermatologist. And if you want to get more information from me, you can visit the CareClues app or you can just click on the link below. Thank you so much.
With a network of over 11,000 doctors, avail quality healthcare services 24/7 on CareClues. Book your online or in-clinic consultation today. Thanks for watching. Don't forget to like, share and subscribe.